Dr. Nichelle Gerlay, specialized in prenatal, postpartum, and pediatric chiropractic care and fitness, along with specializing in postpartum rehab. We're going to go over the elevated pigeon, which I like during pregnancy for a lot of moms, not for all, but a lot, to open up the glute medius, which is a hip stabilizer muscle. It's kind of the side butt region right here. It's not the glute max. The reason why we want to open that up, or why it gets tight, is that we have relaxin opening up and loosening all of our ligaments, which are supposed to hold bone to bone. When they're not doing that job and they're all loosey-goosey, the muscles come in to compensate and create that stability. And so they get overly worked and tight. When they get too tight, that can cause pain. So it's nice to do elevated pigeon stretch just to start opening up that muscle a little bit so it's not quite as tight. Elevated pigeon is a great stretch to do as opposed to doing it on the ground when you're pregnant, because of that pregnant belly that can get in the way. It also helps keep your pelvis level. It's a lot harder on the ground to get into this position, and so a lot of times people open up the hip and then their pelvis gets all off. That's not really the best position to be in during pregnancy since the hips are so loosey-goosey. We want to keep in a nice level position. So you're going to bring the leg to 90-90, and you can stay up at this position in proud pigeon, or you can come down into sleepy pigeon if your muscles allow and that stretch allows. I recommend 2 minutes of stretch on each side just to open up that glute med. And again, that's elevated pigeon. And this is something that if you know you have ligament laxity, you should consult with a healthcare provider for, as this may not help the aches and pains that you're feeling in your hips.